Welcome, welcome, welcome you all back to another episode of Excuse Me, Doctor. Thank you so much for joining us tonight. My name is Dr. Melissa Clarke. Please call me Dr. Mel, and I am delighted to be your host. You know, we are here every week doing what we do right here at Excuse Me, Doctor, making sure that you have the information you need to make wise health decisions. We're every week on Sirius Channel XM 141 HUR Voices. And of course, we're streaming on YouTube and Facebook, taking questions live. Now, if you're newbies to the show on those platforms, please hit us on Dr. Melissa Clarke at Facebook and hit us with a like. And if you're on YouTube, Dr. Melissa Clarke, please hit that red subscribe button. Really appreciate you for that. And remember, put those questions in the chat because it's first come, first serve, right? And of course, if you're on Sirius XM channel 141 HUR Voices, keep that dial locked. So now let's get into creating an amazing week for ourselves with all the health topics we're going to cover today. And in order to do that, you know who I need to bring in, right? None other than the wonderful Miss Lila Mays and the fantastic Mr. Wayne Bruce.
Howdy. What's going on? Happy Valentine's Day, Dr. Mel. Happy Valentine's Day, La.
Yep. Happy Valentine's Day.
Happy Valentine's Day.
Hey.
So yeah, Valentine's Day. What are we going to talk about tonight, Dr. Mel?
Well, yeah, we are going to be talking today about the celebration of love, but really a celebration of self-love, because there's so many different kinds of love, but they all start off with self-love. So tonight we're going to talk about how to overcome some of the blockages and challenges that we have to loving ourselves. We're going to look specifically at therapy, and we have two fantastic guests who are waiting in the wings to walk us through that. So I'm really excited about today's show.
Me too.
I'm excited. You got to love yourself. You got to be able to love yourself before you can love other people.
Yeah.
That's right. That's right. So share, and share again with anybody who you know who's thinking about therapy or struggles with self-love. You know, that could take the form of self-sabotage, poor confidence, somebody whose picker seems like it's off. You know what I mean? Pick by picker, like picking people.
So I was like, the
with all of those folks.
I thought you was talking about their nose.
No.
No, yeah, we know people who always pick the wrong people.
Right. So share it with all those folks and, you know, get your questions. Like I said, get your questions lined up because we're going to be taking them with our fantastic guests as soon as we get to that. But right now we got something else going on, right?
You know what time it is. It's time for the recap.
All right.
There we go. It's the week that was.
All right. So, we normally start off with the numbers, and we're going to do that tonight. So we're talking about COVID cases have definitely surpassed 77 million. They're probably way past that because people aren't testing as much because COVID is mild to almost no symptoms in many, many more people now. But the case numbers are continuing to trend down, which is good. Just as fast as Omicron blew in, it's on its way down. Right. And exactly a month ago now, we were looking at over 900,000 cases a day. So now we've dropped below 200,000 cases a day, we're right around the peak of where we were with Delta, right? Even though we're on a downward trend. So we still have a lot of cases a day.
Right.
And hospitalizations have decreased. And deaths finally have started to go down. Unfortunately, we've surpassed 922,000 deaths. But I know it's staggering. It's hard to really wrap your head around that. And it's also equally hard to wrap your head around the fact that over 2,000 people a day are still dying.
That is
unbelievable.
Wild. It really is.
It is.
It really
and that
is.
whole Yeah, the whole thing about Omicron is milder than Delta, that might be, but because it was so much more infectious, the
Mhm.
death rate from Omicron, the daily death rate is exceeding and has exceeded the death rate from Delta.
Really?
Wow.
Wow.
Yeah, exactly.
Wow.
So the other thing I just want to mention here too is we haven't mentioned this in a long time, but people should know that if they've had a loved one who died from COVID-19, they are eligible to get reimbursed up to $9,000 in funeral expenses. You must have a death certificate that lists COVID-19 as the cause of death, though.
Wow.
And there's some paperwork, supporting paperwork that has to be submitted, but don't forget that that's something that might be able to help you out, in your time of loss, unfortunately.
Great to know. Really, really, really good to know. So we're still talking about the numbers because it's important. So we can't talk about the numbers without talking about vax facts.
That's right.
So where are we with vaccinations, Dr. Mill?
Yeah, so we've surpassed 252 million vaccinations. That represents about
Okay.
68.4% of the people who are eligible. So that's everybody over 5. And
Mhm.
again, shout out to the 65-year-olds. 65% of them are now boosted. So they've not only gotten their first 2 shots, but they got the booster. Um,
Okay.
and just, something that was actually pointed out to me by Dr. Cam Webb, who works with health equity and vaccines in the White House. He mentioned that whites account for 66% of the people who are unvaccinated. Whites represent only 61% of the population. So they're disproportionately represented in the numbers of people who are unvaccinated. So I would like to encourage our white brothers and sisters to get vaccinated. And because those who aren't are putting themselves in harm's way as well as others with whom they interact. So I know we
Right.
focus a lot on you know, Black people and other minorities, but we specifically need to also say that white people need to get vaccinated too, because we are all in this together. That's, the nature of a pandemic is you can't get out of it unless everybody is
Committed.
has their paddles in the water, yep, and are rowing in the same direction.
Right.
Yes.
Indeed.
Amen.
So, speaking of COVID, the 4 factors that might increase your COVID risk. What are they, Dr. Mill?
So this is like hot off the press research that's come out. It looks like, and we're specifically talking about your risk for severe COVID, right?
Okay.
Mhm.
All right.
So they looked at people who had severe COVID, and the things they had in common were these 4 things. The first is high levels of virus. So early on in the infection, specifically. Um, and that actually might be why vaccinated people are at lower risk for getting severe COVID, because you have antibodies at the ready that prevent the virus from rapidly multiplying in your system. And so that would prevent you from progressing on to severe COVID. The other thing is auto antibodies. So it looks like those people who go on to develop severe COVID develop auto antibodies. Now, what are those? Those are antibodies that mistakenly start to attack your own body. And so we see that in conditions like lupus or rheumatoid arthritis. So the presence of high levels of auto antibodies in your system correlates with moving on to severe COVID. The third is reactivation of Epstein-Barr virus. Now, there's certain viruses, especially those in the herpes virus family, of which Epstein-Barr virus is one of those, that when they infect you, they never really leave. They just kind of go into hibernation.
Mm-hmm.
So they're seeing that people who have a reactivation of this Epstein-Barr virus that's just kind of hanging out but asleep in you, when you get COVID, if it reactivates, that seems to also cause people to get severe COVID. And finally, those people who have type 2 diabetes, that also seems to be something that correlates with people getting severe COVID, which we already knew. And researchers just haven't gone on to focus on the other diseases. So, other underlying conditions that we've talked about certainly correlate with going on to get more severe COVID.
Okay. So for as long as we've been talking about COVID, vitamin D has come up. So let's talk about that, Dr. Mill.
Yeah, so there was a new study out of Israel that showed that half of the people who were vitamin D deficient before they
Mhm,
got COVID
mhm.
went on to develop severe illness.
Wow.
And that's compared to less than 10% of the people who had normal levels of vitamin D going on to develop severe COVID. So we know that vitamin D comes from direct sunlight on the skin. People who are
Mhm.
melanated, more melanated, have a harder time absorbing vitamin D, so have to stay out in the sun longer to get the same effect. But you can also get it from foods like fatty fish, mushrooms, egg yolks, for example. Um, and the findings of this study suggest that vitamin D helps to bolster the immune system to deal with respiratory viruses. But keep in mind that, as I was explaining before about the factors that make you go on to develop severe COVID, vitamin D and a low level of it is only one part of a, more complex picture. There are other things that go into it. So, certainly focus on your vitamin D level with your doctor, get your levels checked, get them monitored, get on a, if you need a supplement or you're going to get it from diet, however you're going to do it, monitor those levels over time to make sure that they stay in the therapeutic range. But make that one of your focuses, but don't assume that it substitutes for the other things like getting
Right.
vaccinated, physical
Right.
distancing, wearing your mask, etc.
Okay.
Okay.
All right. So February is Heart Health Month. Am I correct?
Yes.
Yes, it
Yes.
Generally
is.
correct, because I'm like that. I'm smart like that. So,
Got that one right. Yep.
what are the 3 signs that you must get your heart checked up?
Yeah. So, we've been putting off a lot of healthcare during this pandemic, and we know some of the obvious signs that we might have a problem with our heart, like, chest pain, upper back pain, jaw pain that's new and unexplained, new windedness, shortness
Mhm.
of breath, lightheadedness or palpitations. If any of those things happen, we pretty much know those are things that should trigger us to go get checked out. However, some more subtle things might include if you're not able to do things with ease that you used to, and they're leaving you more winded. So I read an article about a woman who's 43 who feels like she's 80 because she can't carry her son up the driveway anymore. That's a sign of you might need to go get checked out. So things that you used to be able to do easily that you can't anymore.
Mhm.
Um, your blood pressure is increasing, especially if you're already on medication. So we know that our goal blood pressure is about 120/80. Um, and so if we see that creeping up over time, that's a sign that you need to go get your blood pressure checked. And then finally, I'm sorry, your blood pressure and your heart health checked. And then finally, your resting heart rate is increasing. So, our heart rate is a measure of how hard our heart has to pump to get blood around the body. And it changes whether you're, reading a book or
Mhm.
exercising or laying in bed or standing. Our normal resting rate is between 60 to 100, but the lower you are means the more fit you are. So if over time, you were in the 50s, now you're in the 60s, now you're in the high 70s, and now your resting heart rate is in the 80s. If you're seeing those changes happen over time, again, that's a time to go get your heart health checked up.
Cool. That's
All
good to
right.
know. I mean, I'm quite sure Lila's is in the 30th, so
Well,
resting
I had
heart
my heart
rate.
checked this morning.
Did you?
So
There you
That's
go.
I
see,
did.
that's self-love. That's loving yourself, Lila.
Mhm.
Right.
That is
And
loving yourself.
self-care.
So,
Yep.
I know a lot of our friends and a lot of my friends, and even I have parents and loved ones who have dementia. And now it's some studies linking with dementia and with its links to blood pressure medications?
Right. And I don't want that headline to be misleading.
Right.
There's nothing that shows that pressure medicines cause dementia. Actually, it's the opposite. It seems like there's certain blood pressure medicines that are associated with lower rates of dementia in
Wow.
later years. And the ones that are associated with the lower risk of dementia there's something called angiotensin 2 receptor blockers, or ARBs.
Okay.
As compared to ACE inhibitors or beta blockers. Now, I don't expect everybody to remember those technicalities. The take-home point is the ACE inhibitors and the beta blockers do have specific uses, right? So I don't want anybody to ask their doctor and find out, oh, I'm on an ACE inhibitor, I'm on a beta blocker, oh, take me off of it. The more important thing is to have the conversation with your doctor, mention that you heard there's certain blood pressure medicines that are associated with a lower risk of dementia down the line, and just have a conversation with your doctor about what kind you're on and what's best suited for whatever you're being treated for. So just to bring the topic up with your doctor.
So don't play doctor yourself and be like, I read my medication is is ACE inhibitor. Don't play doctor.
Exactly. Because there might be a specific reason that you were prescribed that, because it is good for certain things.
Okay.
Right.
Got it.
Yep.
Okay. So you do know what time it is.
What time is it now?
Time to check my watch. No. It's time for the
weekly debunk. Stopping misinformation in its tracks.
So this week, Tanisha Twitter Fingers. Well, it's her cousin this week, right? Tanisha Straight. Tiffany Twitter Fingers said, I'm just gonna get a fake vaccine card for my son so he can go to school. I'm not trying to get him vaccinated for real. Children don't even get real sick from COVID.
You had to hit Tiffany back like this. I don't know about that. Excuse me, Dr. Mel, is that true?
Well, this is a deal. Children do get much milder symptoms from COVID on average than adults. But since children can become infected and transmit the virus, being vaccinated means they're less likely to be sources of spread of the COVID virus. But then there's also a reason for children themselves, for their own health, to be vaccinated. We know, of course, that children, of course, die at a much lower rate than adults, but death is not the only thing that the negative outcome from COVID. There's also long COVID, and there's also the multisystem inflammatory syndrome, or MISC, in children, where the children get very sick. And this is like, a couple weeks after the initial infection, which could be mild or no symptoms at all. And then they have severe inflammation a couple weeks later. And so we also want to avoid our children getting this. And the bottom line is, we don't really know the long-term effects of a COVID infection. So who wants to impose that on a child who has a developing cardiovascular system, developing neurologic system? I wouldn't play fast and loose with my child potentially getting COVID. And then, there's also the concern many parents have heard about myocarditis, or that heart inflammation. But the bottom line is this: with myocarditis, it's still very rare. So among 100,000 vaccinated adolescent males, which is where myocarditis is seen most often, 7 would be expected to develop myocarditis after the vaccine. But if they weren't vaccinated, that same group, more than 5,500 of them would get COVID over a period of 3 months, which would result in, on average, 50 hospitalizations, potential for the MISC that I talked about, myocarditis from COVID, and possibly death. So it's much more safe to get vaccinated than to not get vaccinated. And we know that during the Omicron variant, hospitalizations were about 850 hospitalizations a day among children under 17. So the other thing to keep in mind is that 75% of those kids getting hospitalized are Black and brown children.
Yeah.
So the people who are encouraging avoiding vaccinations for children aren't acknowledging this fact, this disproportionate effect of COVID and severe COVID among children of color, making it seem like all kids have the same outcomes. And that's just simply not true.
Wow.
All right.
And that's good to know.
Yep.
Right.
Well, thank you, Lila and Wayne, as always, for walking us through our debunk and our recap. I'm going to see you very shortly, but we are going to move right on into our show for tonight. And we've talked about the fact that we are celebrating love today on Excuse Me, Doctor, by talking about self-love and how to get to the point of healing those blockages that prevent us from doing what I call treating ourselves as if we were a child left in our own care, right? Because we know that self-love is the greatest love of all. I mean, Whitney Houston told us that, right? And so it's the foundation of any relationship or relationships that we have. So to walk us through this topic, we at Excuse Me Doctor are fortunate and blessed to have two fantastic guests tonight. Our first is Dr. Delvena Thomas. She's a veteran, she's an author, but most importantly, she's a physician who is board certified in both psychiatry and neurology. She's a tireless advocate for ending the stigma surrounding mental health, especially in underserved communities. And she's regularly appearing on multiple media, television, talk shows, radio shows. So we're really fortunate and blessed to have her here with us tonight. Hi, Dr. Delvena. How are you?
Hi, I'm very well. Thank you for having me tonight.
Absolutely. Thank you for being here. And we have with you Mr. Mark Harrison, who also happens to be a veteran. And he was recently appointed to be Chief Executive Officer of Prince George's County, Maryland Department of Homeland Security. But he is here with us tonight because he's a constant advocate for mental health, especially for African American men, and is founder of the program called Saving Our Kings. Hi, Mark. Thank you so much for joining us.
Hey, good evening, Dr. Mel. How are you?
I'm doing great, and glad to have you back because you are a friend of the show. So thanks for coming back.
Thank you. And happy Valentine's Day to both of you ladies also.
Well, thank you, and same to you.
Thank you.
So I want to start off with a question to both of you, and Dr. Delvena, maybe you can answer first. Can you start off by defining self-love for us?
Self-love there's so many layers to self-love. Self-love first starts with, I believe, self-confidence. Self-confidence and self-awareness of who you are. Self-awareness means you acknowledge what you're good at and what you need help with, what you could do better. Because oftentimes people struggle in acknowledging what they struggle with, or they struggle with acknowledging what they don't know. And it's important to be able to acknowledge all of those things because it will prevent you from allowing yourself to be caught up in some sort of problem or a conundrum because you're not self-aware. So self-love includes self-awareness, self-confidence, self-esteem, and it also just includes the fact that you acknowledge that your brain is the strongest part of your body. There's a term that I coined called brain love. And so self-love is being able to embrace brain love and know that you have to take care of your brain. You have to take care of yourself. And so I would just start with those things first, the self-confidence, the self-awareness, the self-esteem, just to
You
start with.
mentioned, yeah, you mentioned the brain is the strongest part of our body. Can you elaborate on that?
Well, without your brain, you can't do anything. Your brain controls everything that you do. It controls our blinking, our talking, our emotions, our walking, the way we react to someone, how fast we react to someone, how slowly we react to a situation. Everything is controlled by the brain. Loving someone is really controlled by the brain, although some people allow other parts of the body to take over and tell you whether you should love someone or not. But the brain is really what you should rely on when you're making those types of decisions. So without your brain, we have nothing, because everything gets coordinated up here. Everything gets coordinated in this control center, is what I call it.
Got it. Got it. So Mark, talk to us about self-love. What do you think of when you think of self-love?
Actually, this is an interesting topic. I was actually just talking to my therapist about self-love today. And come to find out, I thought I loved myself and loved everybody else. But all actuality, I was self-sabotaging myself. It goes back
Mm,
to my pattern, what I was thinking, what I was doing. So talking to her a little bit more in depth, she told me to break it down by three different components. One being behavior, emotions, and your thoughts. And it kind of goes back to what Dr. Delvena said. My emotions was basically, I need to learn how to forgive myself. That self
mm,
forgiveness made a world of difference. My behavior, I had to learn how to ask for help, practice self care. I wasn't doing any of that. And how it really impacted my friendships, even my working relationships, and then my thoughts. What am I thinking about? Do my thoughts become my actions, and learning how to really turn it around to make it more positive for everything and everybody around me. So self-love is just really diving in. Your brain, as Dr. Davina said, your brain controls everything. And for me, the self-sabotage, because the lack of therapy that I wasn't getting, the lack of awareness, it was everything. So self-love today, it really came out. Here I am, 50 years old, and really now understanding what true self-love actually is and what it means.
wow, that's beautiful, and I'm sure it has been a journey. And I love that you mentioned the self-forgiveness up front. What do you think are some of the greatest obstacles that we face to self-love?
Whew, that, that's a good question. One, we don't know how to self-love. We don't even know what it is because we're not taught that. Especially men, we are taught to be the warriors, the go-getters, be don't show emotions, fight for everything that you want. Love. If we tell a woman that we love her, 9 times out of 10, we don't even know what it is. It's just something easy for us to say. So loving somebody else may be a phrase that we use, but all actuality, we don't even love ourselves. And most of the time, we don't even know how to love ourselves because as men, we're not even taught that. We're taught to fight and be the provider, not to love and show emotion.
Wow, that's fascinating. So you mentioned romantic love. Dr. Delvina, how do you think, or how have you seen in your practice that the lack of self-love can lead to difficulty forming relationships or sustaining relationships?
So, first, I would start by answering the question that you just asked, Mark, and that's what impedes self love. Self love is impeded by feeling like you're not good enough. There
Mm-hmm.
are
Mhm.
people who don't love themselves because they feel like they don't deserve to be loved. They don't
Mhm.
deserve to be loved by others. They don't deserve to be loved by themselves. And they never learned how to love themselves because they weren't taught that in their household. And so, in certain socioeconomic statuses, certain things are not considered priority. Self love is probably rarely talked about in certain households. And so if you grow up in a household where your mother and or your father or your parents or your guardian, your grandparent, your aunt, your uncle don't talk about loving yourself and why it's important and why we have to take care of ourselves and treat our bodies as temples, for some Black folk, church has become very important for them. It's integral, and it has at least taught that part, that piece of it, and that is your body is a temple. You treat your body such as a temple. You take care of yourself. So self love for some people can stem first from the church, from religion, but people who don't have that in their life, if they don't have a replacement, then they don't learn how to love themselves. The other roadblocks to self love are past relationships, past romantic relationships, especially. If you've been in abusive relationships, if you've been in relationships where they weren't healthy for you, they were toxic for you, it was a relationship that teared you down and made you feel worse, that berated you, that stands in the way of learning self-love. And so those are some of the main things, our childhood, our experiences with personal relationships, and just simply not knowing how to love yourself. And so if you don't know how to love you, how do you expect another person to embrace you and love you? Because you don't even love yourself. And when you don't love yourself, you will stand and you will fall for anything. You will allow a person to do anything to you. And that's not just in a personal, intimate relationship. That's on the job, that's with friends, that's with family. When you're self-confident and you're self-aware and you love who you are, when someone talks to you a certain way, you're not for it. You're not having that. You're going to check them.
Right.
You can check them professionally, but you're going to check them and you're going to set those limits and those boundaries.
Right, right. And I think even how you respond to them might even indicate your level of self-love. Like you said, you might respond to them professionally as opposed to violently, right?
Exactly.
Right.
Hey,
Exactly.
I have a question for Dr. Delvena. And I'm going to use me as an example. The first time I ever heard somebody say that they love me, I was 21 years old. And
Ouch.
well, I'm not done. You ready for this?
Mm-hmm.
And it didn't come from my parents. It came from my
Right.
home. It came from my homeboys. And I can remember on my hand how many times my parents have said, "I love you, son," and it's less than 5. So that's where the whole self-sabotage came in for me. I was in the streets trying to find love. I would gravitate towards my friends' parents because I saw the love and the cohesiveness in the house. And then I had to realize, look, what is going on? And I can remember saying to my parents one day with one of my siblings, "When is the last time you told her that you loved her?" "Well, I didn't grow up like that, so I don't say that." Then I
Right.
look at the effects that it has on my siblings also.
And I
Yeah.
think,
I have a,
I
I,
think
could
you bring up an excellent point because I was exactly where I was going to go, which was parenting, which I know Dr. Delvena, you mentioned.
mm-hmm.
If you could, wrap in your answer to what Mark was saying, but also talk about, what are the roots of the parent not saying I love you, and then how does that get perpetuated on generationally?
Oh my God. In the Black community, it's so profound. It's post-slave syndrome. There are
Mhm.
some professionals who don't believe in such a thing. They feel like slavery is over, Jim Crow has ended, you know, we should get over it. These things are not long lasting. We're past that point. Whereas, really, there's a lot of trauma that has been passed from generation to generation that began in 1619. You
Mhm.
go to a country and you kidnap people, you take them away from their culture and what they knew, and you bring them to a new place. They don't know the language, they don't know anything, and you force a certain religion down their throats. And you don't allow families to form. You don't
Mhm.
allow people to maintain families because you're too busy treating them like property. You're too busy stealing their children. You're too busy raping the women. You're too busy raping the men. And so, a lot of these things go back to the trauma that we as Black folks experienced from slavery. And what I wanted to ask you, Mark, is what year were your parents born, if you don't mind?
Uh, 40s, 50s. My mom had me when I was 17 years old.
Gotcha. Okay. So, when you think about it, slavery ended officially in 1865. 1865. And so, for certain folks, their great grandparents, their grandparents, they're just one generation removed from the ending of slavery. My parents grew up during the civil rights era. My parents are originally from Mississippi. I know I'm a descendant of Black gold. And so, for Black folks, we didn't learn how to say, some of us, in some of the households, we didn't learn to say I love you. We didn't grow up with that. So we weren't able to teach that to our children. But the good thing about what you're doing, Mark, is you're acknowledging that those things were lacking for you growing up. And so I'm sure moving forward, that's something you'll pass on to your lineage, to your legacy. You're bringing it up for your siblings to acknowledge it as well with their parents. And so to answer your question, Doc, we have to basically break these cycles. We have to break these generational curses.
Right. And I'm glad you brought that up and mentioned those things, because one of the other things I wanted to add on to what you said too is think about the trauma of being separated and knowing at any time you could be separated from your family. How do you, what sort of defenses do you have to form emotionally to be able to survive that? It would seem like one of the things you would do is wall off your emotions and not tell people that you love them and de-emphasize that, because at any moment, whatever your marriage, your relationship with your children, your parents could be destroyed at any minute. So, and that brings me to, what is therapy and how can it help to address some of the issues that we've been talking about? Dr. Delvena, if you could start.
So, therapy is being your authentic self. It's going into a room with a professional. Therapy, you ain't having therapy when you sit with your girls or with your boys and you guys are just, chopping it up, talking about stuff. That's not therapy. So, when I ask patients, what is your support system? How do you deal with stress? Oh, I talk to my friends and, they're very helpful. And so I give them the notion of, hey, have you considered psychotherapy? Because this is a person who's trained to conduct a dialogue with you in such a way that it's enlightening, it becomes insightful, and it helps you to find your own path to your own solutions. Therapy is not telling you what to do. Therapy is not teaching you what to do. Therapy is not it's not a dictatorship. It's not someone telling you this is what you'll do and this is how you'll do it. It's helping you to understand dynamics and things and understand yourself so that you can arrive at healthy decision making. Therapy doesn't work though if you show up to that office and you're not authentic, if you're not honest, if you're not putting it all on the table. So when you decide to venture down that road, you have to be prepared to be vulnerable, to expose yourself.
That's an excellent point. And tell us about your work with Saving Our Kings, Mark. What are some of the what are some of the things you do, and what are some of the obstacles that you hear brothers come up with in terms of maybe not wanting to pursue therapy?
It's going to therapy for them has been a situation where it's the lack of vulnerability. And I've been telling them, a true man who is vulnerable is a sense of masculinity themselves. So it's been pretty good in that aspect. The men are talking, but have to create a safe space. Without creating that safe space, they're never going to talk. And I'll share the story before, and I've been kind of open about me going there. But unfortunately, my therapist died. And it took me years to find a therapist. One of the bad, yet be a particular day. Great. Once I started going, he created that safe space. I was able to be vulnerable. And then all of a sudden, he died. Okay?
Right. You know what, Mark, I think we might be having some problems with your audio. For right now, I'm just gonna switch back to Dr. Thomas and ask, when you go through therapy, because this is Heart Health Month, I'm asking this question, can it also have effects on your physical health as well?
Oh my God, absolutely. Stress and anxiety can elevate blood pressure, can elevate what we call stress chemicals or stress hormones in the body. Those catecholamines can lead to other negative effects on the body, like elevating blood pressure, causing issues with certain organs. Stress and anxiety, when your blood pressure it becomes so elevated, folks have experienced heart attacks and strokes. That happens a lot. It's not just based on your diet, right? It's not just based on diet, but stress can also cause consequences for your heart health, as I said, with blood pressure, strokes, and heart attacks, but also can elevate your blood sugar. People who are very stressed, it can cause abnormalities for blood sugar and can lead to things like diabetes. So going and seeking psychotherapy, something that's going to allow you to be calmer, to become more tranquil, that will teach you how to deal in a stressful situation, that will give you the coping skills to deal with stress, or, maybe you have some relationships that are off balance with your family members or with a good personal friend or a significant other. Learning how to deal with those things will likely reduce the chances of you feeling that built up stress, that pressure, which can then lead to the issues with the issues with your heart, the issues with your blood pressure, the issues with your organs, the issues, with your blood sugar. So going to psychotherapy and just being able to unload everything. And don't get me wrong, psychotherapy doesn't always make people feel good. There are people that go to a session and they feel like, I almost use profanity, they feel like crap at the end of the session, because your therapist is just basically torn you down. And what we try
Right.
to do is we try to build you back up, though. We don't
Right.
want to
Like
send you
peeling the
back out
layers of
into the
onion. Right. Yeah.
yeah. And we try to end the session with enough time so that we build you back up. We don't send you back out into the world torn and broken. So,
Mhm.
but psychotherapy won't always feel good. And when you're doing the work, it's not supposed to feel good all the time. When you're doing the
Right.
work, psychotherapy is work. Taking care of yourself is work. Living life is work. Life ain't easy.
Right. It's almost like, building muscle, right? You get the burn
Yeah.
while you're working out, but, overall it makes you healthier. So I can't believe I have all these other questions for you, but it is time to bring our audience into the discussion. And so I'm going to
Yay.
ask, I'm going to ask Lila and Wayne to come on back in and bring the audience
Wow.
perspective and audience questions in.
Great discussion. Great discussion. Lila.
Indeed. Yeah, I have several questions actually. So this one is a two-parter. I'll start with you, Dr. Delvena. Can you give us maybe 3 self-love practices? And then Mark, I'd
Ooh.
love for you to jump in there too.
Wow. So I'm going to use myself as a personal example. My self-love practices, number one for me, massages. I schedule a massage and I'm intentional about it, because if you don't keep a running schedule, you will
Yep.
go 3 months and you haven't been touched. You haven't had your body touched. So I like to get my massages. I like to get my facials. So that's number one. For women, a lot of us will go to the nail salon and go to the hair salon. That can be considered self-care, self-love, but that ain't really like self-love, going to get your hair styled, because oftentimes, especially in some of these black salons, it's a wait.
Okay.
Unless you have a great stylist. So you're gonna, you might have some stress going in the salon and you
Yep,
wait
that
2 hours to get in
contributes
a
to some
chair.
stress. Right.
Yeah. But my number one self-love way to love on myself is to travel. I love to travel. Travel therapy is my way of giving myself self-love, treating myself to a nice trip, going to a different place, to different surroundings. Traveling by myself is self-love, because I just want to be on my own. I want to be in my own thoughts. I don't want to worry about other people. And then, other things just like walking and being out in fresh air, exercising, taking care of your body, taking interest in yourself and taking care of yourself. And the last thing I'll say is music therapy. That's my other way of
Okay.
taking care of myself, because I just love music. Jazz, I love it.
All
Nice.
right. Mark, you
Mark.
want to add anything onto that?
Yeah, for me, my go-to is the gym. Um, 6 days a week, I am in that gym, just letting everything go, let the worries and the troubles go. Something that I started probably a couple of months ago was writing in a guided journal. I have a journal that is so deep that sometimes I'd be like, whoa, I can't even answer this question today, because it makes me want to go there. But I love it. And it's weird with this journal. I'm telling all my boys about it. Yo, I need to send you this journal. This journal is like that. And the crazy thing is written by a woman, but she is on point. She captures everything. And lastly, it's the music, but I also have an 8-month-old puppy that I love. You know,
Oh,
Oh.
women
Okay.
always say that.
We gonna bring the puppy in.
Yeah. As much as he gets on my nerves, he brings me joy. You know, because he loves me unconditionally, regardless of what is going on. If I'm having a bad day, he doesn't care. If it's a good day, he doesn't care. Just him jumping in my lap changes everything for me that whole entire day.
Wow, those are great answers. I just want to throw in there having a gratitude practice.
Mm.
You know, because a lot of times stress comes from feeling like you don't have the resources to meet whatever the issues are that's going on in your life. And when you stop and think about all the things that you do have, it can help just reduce stress and is an act of self-love. And then what you focus on expands, right? So having a
Absolutely.
gratitude practice
Come on.
is good for me
Yeah,
as
I
well.
love that. Yep.
Come on,
I,
Dr. Mel.
I'm gonna piggyback on that too. I'm gonna piggyback on that, Wayne, and just say one of my self-love practices is affirmations. And
Mm-hmm.
even if I'm not feeling that thing that I'm saying, um, you look beautiful today. Even if I'm not really feeling the thing, I say it anyway and get to a place where I receive it, believe it, and feel it. So
Right.
that's one of my self-love
Great.
practices.
I think you have to believe yourself first
Yeah.
before anything else happens.
Before
We
you
have a
can believe
question.
anything else anybody else says, right?
Right. We have
Right.
You have a
Mm-hmm.
question, Wayne?
we have a question from Yvonne Smith. What is broken heart syndrome? Anybody?
Dr. Delvena, would you like to take that one?
Something someone made up.
Okay.
Ain't
Where
no
did that
clinical
even come from?
diagnosis called. There is no clinical diagnosis called broken heart syndrome. You know, we just, so if she's referring to, and ma'am, I'm so sorry, or sir, I can't remember who you said asked the
Is
question.
Yvonne.
Yvonne. It's
It's
Yvonne,
slowly,
okay, ma'am, please don't be offended by the laughter. Humor and laughter is the upper defense mechanism. We're just having a good time here. But seriously, broken heart syndrome is not a clinical term. Perhaps it's something I would think could occur after a breakup with someone you truly love or who you believe you love and you're trying to move on. When we break up in relationships, we go through grief, we go through bereavement. It's almost like someone has died, has passed away. I'm sure all of us can think about that one big old breakup we had, and it felt like our heart was broken into little tiny pieces. I remember my son when he had his first breakup, I told him, this is good. It gets easier from here. You need to get used to it. It's going to continue to happen until you get married and you settle down with that one. So I'm going to guess and say broken heart syndrome is missing a person that you were truly in love with.
Great answer.
I think Dr. Delvena, yeah, I've heard the term before, and mostly I've heard it after people who've been married for a really long time, they lose their life partner. And so I think you hit the nail on the head in terms of it being grief.
Okay.
I think grief is the biggest part of what we what we sometimes refer to as broken heart syndrome.
And I think also too, a self-love practice allows you to have more resilience in the face of those kinds of traumas, whether it be
Mhm.
broken heart syndrome or any other challenge that you go through in life that might seem to rock your foundation.
That's right, Doc.
Any other questions?
Uh-oh, we can't. I
I
do
think
have a
we're on.
question, Wayne. We can't hear you, so I'll jump in with my question. This is for everyone on the panel. This is from Paige Rice. How can we free ourselves of the need for approval from others?
Wow. Why don't you start with that one, Mark?
It goes back to self-love again. You have to know who you are, know your value, know your worth. To me, once you know who you are and the value that you bring to anything, you don't need anybody's approval. You know, just continue with those self-affirmations, applaud yourself, reward yourself, love yourself, but more importantly, value who you are. And no one's approval means anything. It's all about who you are and what you want to do.
Anything you want to add, Dr. Delvena?
No, I think he said it perfectly.
All right. Fantastic.
Okay.
Wayne, are you back with us?
Yeah, I'm back with you.
All right.
Cut
What you got?
myself off there, but
He's
I
mad.
am
He
back.
cut himself off.
Cut myself off, but that's okay. Yvonne had a follow-up. She said married couples often die within days of each other. It might not be a diagnosis, but it happens.
Oh,
Okay.
yeah.
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 And I
Agreed.
guess she's
Yeah, agreed.
referring to that. Okay.
Agreed.
All right, Lai, you got another one?
I don't. I actually was going to throw it back to Dr. Mel because we have some statements, Dr. Mel, but I know you had some more questions, so I'm going to let you pull out some of your questions.
Absolutely. Well, one of the questions that I had was for Dr. Delvena. I know that you have sort of a multimodal practice, a lot of different things that you bring to bear. What are some of the other aspects of your practice that you, other than psychotherapy, that you might use in terms of helping individuals work on self-love?
Yeah, so we have a wellness spa. We have two offices. The main office is our basically, well, most of it's virtual now, but the main office is medication management and psychotherapy. And in our wellness spa, we do facials, we do massages, we have a weight loss course that people can go through. They can sit and speak with a wellness coach. We also do laser hair removal for melanated skin because there's not a lot of clinics that are removing, people of color successfully removing their hair. So instead of waxing and shaving, we use a laser that's specific for our skin. And we offer CBD products, and we are certified to provide medicinal cannabis certifications as well.
Wow. Okay. That sounds like a one-stop shop.
Hey, Dr.
We want
Delvena.
it to be.
Yes, absolutely. Mark, you were about to
Yeah,
say?
Dr. Delvena, can you explain to the people who are on this call what is psychotherapy? Because you use the term quite often, and I don't think the audience may truly understand what it is because people are used to hearing the term therapy, but you just threw a
Mhm.
whole nother term in there, psychotherapy.
Right.
I know what it
That's
is.
a good point. That's a good point. Yeah, please go ahead, Dr. Delvena.
Yeah, it's the official way to regard therapy, because there's different types of therapy. There's physical therapy, and then psychotherapy. Those are kind of the two most common that we refer to as therapy. Psychotherapy, obviously, it's based in the brain, and there's different types of modalities of psychotherapy. And just like there's different modalities you can engage in, there are different types of specialists who are qualified to conduct psychotherapy. So I think that's one of the things where people get confused too, is they don't know how to access care because they don't know who to go to. It's kind of confusing. Back in the day, we had just psychiatrists, folks like myself, a physician who is qualified to prescribe medication and also conduct psychotherapy, whatever modality that may be. And we also had psychologists. Psychologists have PhDs or PsyDs. They have graduate education, so they go to college like a physician would, but instead of going to medical school, they go to graduate school and they study, they do a lot of research. They have to do certain tracks to become a clinical psychologist because not every psychologist is qualified or trained to conduct psychotherapy. And then you have the master's level psychotherapists, aka counselors, aka therapists. Those are folks like your licensed clinical social workers. And anyone can pursue a graduate degree and have the title DR in front of their name. Someone can graduate college and go to graduate school and get a master's degree and a PhD in English and be Dr. So and so. So just because someone has DR in front of their name, you can't assume what their credentials are or what they're a doctor of. Licensed clinical social workers can go beyond their master's level and get a PhD in social work and be a doctor of social work. We also have licensed mental health counselors, LMHCs. There are also, and they're on a master's level. There's also licensed marriage and family therapists. You can become an LMFT with a master's level. Some of them will go beyond that and become sexologists or become specialists in sex therapy. So there are different specialists, different clinicians who can conduct psychotherapy. The biggest difference between all of us would be that psychiatrists are physicians. So we're trained in medicine. The basis of our knowledge is medicine. We go to medical school. We can prescribe, prescriptions for anything, not just in psychiatry. And as Doc mentioned, we are certified in psychiatry and also neurology. So psychotherapy is a very specific professional way of working with a person's brain, their emotions, their feelings, their behaviors, and their thoughts to try to create a change in their life to make them just feel better. Some people are depressed every day. Some people are blue every day. So they may go to psychotherapy to deal with that. Some people have traumas in their past. 1 in 4 women have been sexually abused or raped or molested. And so some folks, when they finally want to receive deliverance from that trauma, they may seek psychotherapy to deal with those issues.
Thank you so much for that excellent summary, Dr. Delvena. And unfortunately, I can't believe that we are having to wrap up this incredible discussion. You all have been fantastic guests. Thank you so much for being with us. I think what we can take away from this is focus on healthy love of self, and breaking down the barriers to get to that is really the foundation for a joyful and successful and life full of growth, right, and development. And then all our other relationships will fall into place. So thank you so much. And thank you, of course, to Lila and Wayne for bringing in the audience perspective into that. Before we go, I have to tell you all one more time about this study that we are working on with Howard University. They've asked us to ask our listeners to enroll in a COVID resilience research study. Participation is totally voluntary. And all you have to do is fill out a 2-part survey, and you can be reimbursed up to $100, depending on which parts you complete. And if you're interested, please contact our assistant, Dana Harvey, at danaharveyresearch@gmail.com. That's Dana, D-A-N-A, Harvey, Harvey, research@gmail.com. Or you can call 470-795-0329. All right. Well, thank you so much for joining us. We're going to catch you right here next week on Excuse Me, Doctor, on Sirius XM, channel 141 HUR Voices, as well as Facebook and YouTube Live, Dr. Melissa Clarke. And thank you so much for joining us. If I don't see you anytime before next week, please remember, be wise, be well, and be health empowered. Thanks for tuning in.
Ha ha ha.